Dear friends, so vitamin B12 deficiency is very important issue. We need to give emphasis on that. There are magnitude of symptoms like weakness, like headache, easy fatigability, and sometimes pale skin because you may be anemic. Apart from that, we could have some gastrointestinal symptoms, disturbances like constipation, recurrent diarrhea. So this could be associated with vitamin B12 deficiency. Apart from that, we could have some depressive symptoms, and many times we may face symptoms like difficulty in concentration, some mental block, and very commonly we have some neuropathy-like symptoms, especially the medical terminology we use to describe that symptom as paresthesia, which is very common associate with vitamin B12 deficiency. We may have tingling sensation in our legs, in our hands, and sometimes we may have some muscle cramp. So this magnitude of symptoms may be associated with vitamin B12. If you have this type of symptoms, it is always wise to consult your doctor to get yourself tested with vitamin B12, whether it is deficient or not. And sometimes many drugs like chronic use of proton pump inhibitors, like chronic use of antacids like pantoprazole, like rabeprazole, that may cause vitamin B12 deficiency. And sometimes when we are talking about diabetic patient, they may consume metformin for a long time, and metformin use is also associated with vitamin B12 deficiency. So it is important to consider this vitamin. If it is deficient, we need to correct it as early as possible. So dear friends, we all know that in India, the hypovitamin B12osis or vitamin B12 deficiency is now increasing day by day. One of the very reason behind the development of peripheral neuropathy and nerve-related illness is due to this vitamin B12 deficiency. So there are lots of symptoms of vitamin B12 deficiency, especially when we take some medications, like in case of diabetes patient, metformin. If I am using proton pump inhibitors, common gas reducing medicines like pantoprazole, rabeprazole for a long time, that also lead to vitamin B12 deficiency. So today, this patient who has a deficiency in vitamin B12, I'm giving vitamin B12 injection, and now some pharmaceutic modification, the changes in device make it in ease to provide the vitamin B12 injections. So let's see how it's become easy. So if there is vitamin B12 deficiency, we use this injection. Please take this injection, of course, after your doctor's permission. So first of all, we often choose in adult population while giving this vitamin B12 injection the deltoid region. So this bone you can see, you can feel, this is the acromion process, and here is the elbow joint in between. This area, this fleshy area is the deltoid region. So we select this region for intramuscular injection. If we have very thin needles, one thing is very important. You can see this pack. Why this is black colored pack? Because this injection is very much sensitive to light. That means if there is any light exposure happen to this molecule, this will be damaged. There will be changes in the solution. So we always need to give it in this type of pack, so that this injection should not get any changes by light. So you can see the vitamin B12 injection is there, so much voluminous injection. But if we can use this type of, with this type of needle, very thin needle, very short needle, very easy to administer needle. So just you select that, you do proper sanitization, proper draping, and now select it for intramuscular injection. And you can see this end should be in the upper end. When you are injecting, this should be in the upper place. So like this you have to enter it, and it should be in the 90-degree angle to the surface, because this is very small. Sometimes when needles are larger, we need to give, when it is intramuscular, we need to give it in 45-degree angle. But as it is very simpler, shorter, so we can give it thinner, we can give it 90-degree. So I am just taking it, feeling the flesh of the deltoid and giving it. Don't worry, okay?
Okay.
Okay, good. So I am giving you a small jab, okay?
Okay.
Take deep breath, please. Yeah. Thank you. If you have any pain, no pain, take it. Thank you very much. So this is how we can use the vitamin B12 injection. Thank you.